Hi there, this is Kumbesh Iyyappan and I'll be walking through health data and trends comparison between Zimbabwe and the United States. To begin with, the presentation provides a comparative analysis of the healthcare system in Zimbabwe, which is a low-income country, and the United States, which on the other hand is a high-income country. I'll be focusing on specific areas like healthcare quality, cost, accessibility, widespread health issues, and educational barriers for medical students. The goal is to understand how these systemic, geographic, and economic factors shape the healthcare system in both these countries. To start with, I'll be walking through healthcare quality comparison between both these countries. Zimbabwe struggles with infrastructure, staff shortages, and low GDP healthcare allocation, which is around 6% of the GDP. And the healthcare in Zimbabwe is highly reliant on donor funding from other countries. The quality impacted by outdated equipment, stockouts of medicines, and limited diagnostics adds a lot of burden to the healthcare system in Zimbabwe. Whereas in the US, it has high healthcare expenditure, which is around 17% of its GDP, which will be around an amount of $2 trillion, which is a very significant expenditure. It has high quality facilities and advanced technology use, but US still deals with specific health challenges like life expectancy, which is lower than other developed countries. It has a life expectancy of 77 years according to data in 2022, whereas other developed countries has expectancy of around 80 years. It also deals with specific chronic diseases like diabetes and cardiovascular issues in the country. I mentioned few indicators in the table, but one to highlight is the physician density. Zimbabwe has a physician density of 0.08 per thousand, whereas it's 2.6 per thousand for US. It just shows that there's a huge scarcity of medical professionals in Zimbabwe, which adds a lot of stress and burden to the healthcare system. Next, talking about healthcare cost comparison, Zimbabwe has annual healthcare expenditure per capita of around just $30, and majority of the population relies on public healthcare provided by the government or out-of-pocket payments they had to make for their medical needs. There is limited financial risk protection in the country, and the health insurance is very scarce as only the high-income group in the country is able to afford the health insurance plans. Whereas in the US, the average annual healthcare cost per capita is almost $13,000. The high cost of healthcare is driven by hospital services, administrative expenses, and pharmaceutical prices. Insurance is widely accessible in the US, but insurance does reduce cost, but it leaves gaps for uninsured, which is around 8% of the population, which will be around 30 million people in the US. On the right side of the table, I mentioned few cost metric in Zimbabwe and United States. Talking about accessibility to healthcare, Zimbabwe has limited access due to its poverty state and geographic barriers. Rural areas lack healthcare facilities, and in fact 70% of population resides in rural areas, which is a critical issue because they don't have proper facilities near to them. There are huge number of community healthcare workers who fill the gap, but due to the large population, they're not able to provide the best healthcare solution for the population. Whereas in the US, the access depends on insurance coverage. Urban areas have high hospital density, whereas rural areas face some shortages. Programs like Medicaid and Medicare assist the vulnerable population in the country. On the right side, I mentioned few accessibility metric, but one to look into is the distance to nearest facility. In Zimbabwe, hospital facility is almost 20 to 30 miles away from home, and whereas in the US it's less than 5 miles. If you live in a metro city, it could be just a mile or 2 miles away from your home. it just shows that healthcare facility is very scarce in Zimbabwe. Talking about widespread health issues, Zimbabwe has HIV/AIDS prevalence. 11.9% of the adults deal with this medical issue. There is a widespread endemic disease issue like malaria and tuberculosis. There is increasing burden of non-communicable diseases like hypertension, whereas in the US, the leading cause of death is heart diseases, cancer, and chronic lower respiratory diseases. Obesity is an alarming issue in the country. 42% of the adults are obese, and mental health disorders is a growing concern, but the country is making uh, investments to deal with mental issues. Malaria is extremely prevalent in Zimbabwe, but is extremely rare in the US, so that's one health issue I would like to highlight. Moving on into healthcare education barriers. Zimbabwe has severe shortages of training facilities and faculty. They're dealing with something called brain drain, where a huge population of medical professionals are moving to different countries to practice medicine, which the population is almost 40%. This adds a lot of stress to the healthcare system as they're not able to deploy proper health solutions for the population. Whereas in the US, there's a high cost of medical education, almost $50,000 for full training, and this leads to significant debt for college students, and this therefore limits accessibility for a proper health. And residency shortages add stress to systemic challenges. In the table, there's one education metric I would like to highlight upon. It is medical schools. Zimbabwe has only 3 medical schools to serve its population of 17 million people, whereas the United States has 155 medical schools, which is significantly higher than Zimbabwe. I carried out a comparative analysis which analyzes key drivers. For Zimbabwe, it is economic instability fueled by hyperinflation and unemployment, climate-related food insecurity like droughts and floods, and its limited rural healthcare access, where US has socioeconomic disparities in healthcare and food access, and processed food consumption and sedimentary lifestyles has huge effects on health for US population. On the right side of the table, I mentioned a few key drivers which is significant for Zimbabwe and the US. I did my LMIC2 research on malnutrition trends in Zimbabwe, as it's a very alarming issue in the country. To state a few key stats, 27% of children under 5 are stunted. 76% of rural households in the country deals with food insecurity, and 10% of the population deals with severe hunger, and only 10% of children aged between 6 to 23 months meet minimum dietary standards. And in the bar graph, I mentioned how rural areas deal with more stunting rates than urban areas. And in the table, I mentioned a few metrics regarding malnutrition and the percentage of the population is getting impacted. As we are doing comparison with the current country of residence, malnutrition is not an issue in the country, but obesity is a very alarming issue. 18.4% of children and 42.4% of adults are obese in the country. Micronutrient deficiencies are rare due to fortified food in the country. US deals with overnutrition, where obesity is a significant public health challenge, unlike undernutrition is observed in Zimbabwe. In terms of access to nutrition, despite access to fortified food, disparities in healthy food availability remain an issue in the country because of the junk food and food desserts that are widely available in the country. And Rising obesity leads to increased rate of chronic diseases such as diabetes and heart conditions. This in turn reduces the life expectancy or the average life expectancy in the country. In conclusion, there are a few takeaways. We have observed few significant disparities that exist between Zimbabwe and the US in terms of healthcare quality, cost, and accessibility. Zimbabwe does face a huge challenge in terms of resource limitations and high disease burdens, while US struggles with high cost and access disparities in healthcare. And education and training barriers further widen the healthcare gap in both the countries. This presentation helps us understand how this contrast enhances preparedness for addressing diverse health issues in international deployments. Collaborative efforts and cultural sensitivity is very essential for improving global health outcomes in low-income countries. Uh, this is the end for the presentation. Thank you.